Afrika
awethu
Mayibuye
Afrika
Mayibuye
Afrika.
Viva Azania, viva!
Viva!
Viva Azania, viva!
Viva!
Thank you very much, Sister Connie Mapedi, who kindly volunteered to be the program director for this process, and also who is our chairperson nationally for the new movement that you're going to hear about today. I also want to acknowledge the leadership team and members of Azania Movement standing with me today. And those are on my right. We have Brother Franz Makau, who's our national organizer.
Viva Pradakau, viva!
Viva! We have also our national chairperson, Sister Connie Mapedi.
Viva Azania, viva!
Viva!
Forward with Azania, forward!
Forward!
On my right, we have Brother Tapelo Mufukeng, who's our national spokesperson.
Viva Azania, viva!
Viva!
Thank you.
We have Sister Sanam Durumajar, our Treasurer General, Sister Masha Child, who's our national fundraiser, our Head of Civic Education and Research, Brother Ilunisi, as well as the leadership from the Eastern Cape, and the Head of Elders Council, Hamkwa, which means the Queen in Khoi language, Patricia Aran, the Khoi Queen of the Gorin High Kuna Kingdom, based in the Western Cape. They were unable to attend the press briefing due to prior commitments, but we thank them for their continued support and leadership. This press briefing has three clear purposes. The first one is to formally introduce the Azania Movement to people of South Africa. The second one is to talk about important developments, plans and joint efforts that affect our communities and nation. This press briefing comes after meetings between Azania Movement and different communities, including foreign national communities and Operation Dudula, about the urgent need to fair, legal and practical ways to deal with South Africa's migration and security challenges. The third purpose why we are here today is to explain the policy process we are starting and the way forward. Many South Africans are hearing about Azania for the first time. This matters a lot because what we are going to do, we are going to change the narrative of politics in South Africa. We are not going to be speaking a bombastic English. We are going to be speaking the English that our people understand. We are going to be speaking our languages, and we are going to advocate for Khoi language to be the official language here in South Africa than English language, because English language is a foreign language, but Khoi is the original language of South Africa. Our children, they fail at schools because of English and maths, but maths is also taught in English. So we need to advocate for Khoi language to be the official language of South Africa. Following my removal as the first Deputy President of Afrika Mayibuye Movement, I chose not to retreat into silence. Instead, I returned to engage with communities directly, affected by unfolding challenges in the country and the national governments. Last month, the city of Johannesburg removed many informal traders from areas like De Street, citing bylaw enforcement and unauthorized trading as part of a CBD cleanup. Communities supported by civic formations and legal advocacy groups expressed deep concern about livelihood, social impact and fairness. At the same time, in Parliament, the chairperson of the Select Committee on Education, Honorable Makifeli, publicly condemned threats by Operation Dudula to block foreign learners from schools. He emphasized that such conduct disrupts learning and is unconstitutional. Court later confirmed that Operation Dudula's conduct was unlawful, interdicting the group from harassment, intimidation, interference with access to healthcare, schools, and unemployment. We engaged with community leaders, informal traders, foreign nationals, communities, and civic organizations to understand the realities of the ground. Key concerns raised during this engagement. Foreign nationals say they want to return back home, but are unable due to the risk and the torture that they experience when they hand themselves over. The other concerns that were raised is willingness of those without legal status to contribute to health insurance for excess health care. They say that they can take out 50 rands or 100 or 80 rand, but they want the government to agree and to have a policy to say they are willing to pay a monthly insurance health care so that they are not dudulated when they go to hospitals and when they go to clinics. The other concern that came is that the public health and informal trade crisis, including food poisoning incidents that are affected by children. It was through